I did not know what radiopharmacy is, but because I was pharma keen, she was like, would you be interested and can I help you apply? And I was like, yes. But I don't know what I was applying to. But of course, later I went and researched. I saw it's to do with radioactive drugs, etc., etc. I applied. And who is God? I got a scholarship.
What does a day in the life of a radiopharmacist do?
Tough. I used to see people being recognized at top 40 and 40, and I'm like, oh, 40 millions. And then one day you receive a call from Nation and they tell you you're going to be one of our top 40 under 40 this year. So it was a very big moment for me.
Yeah. If pharmacy was a house with many rooms, what would make radiopharmacy interesting?
That's a hard question. That's a very hard question. When we talk about nuclear medicine, I don't think it's dangerous. A lot of people have come to me and asked about what about your own reproductive health as a woman. And even there's a pharmacist who called me the other day and told me the father is refusing to go for this specialization.
Hi, and warm welcome to another exciting episode of Beyond Pharmacy School. If you're a pharmacy student, a recent graduate, or interested in pursuing radiopharmacy, this is your episode. Today we have an experienced radiopharmacist as our guest, and she will take us through what radiopharmacy is, the steps to becoming one, and what a day in the life of a radiopharmacist looks like. Without wasting further ado, let us introduce our guest.
So my name is Dr. Elizabeth ITOTIA. Okay. I'm a pharmacist by first degree and a radiopharmacist by second degree. Mm-hmm. I work as a radiopharmacist in this country, and with my main workplace being Kenyatta University Teaching Research and Referral Hospital, which is the only public facility that offers nuclear medicine services in this country.
Nice. Could you tell us a little about your journey into pharmacy? Is it the course you wanted to do?
I wouldn't say it wasn't my course of choice because I didn't know about it until after internship. So it's not something I had ever planned to do. From the beginning, I always wanted to do industrial pharmacy because I wanted to go into drug discovery. Then post-internship, I discovered it's not a good career prospect, especially if I wanted to remain in Kenya. It's very good if you want to practice outside, but there's not much drug discovery that happens in this country. So because I kept in contact with my professors from undergraduate, one of them sent me the opportunity to a scholarship opportunity that was open for someone to go and study radiopharmacy. I did not know what radiopharmacy is, but because I was pharma keen, she was like, would you be interested and can I help you apply? And I was like, yes. But I don't know what I was applying to. But of course, later I went and researched. I saw it's to do with radioactive drugs, etc., etc. I applied. And who is God? I got a scholarship.
Nice.
And that's how I became a radiopharmacist. Yeah.
How did it feel like being the valedictorian?
Of course, it was a very proud moment, not only for me, but also for my parents. So it was more of a highlight for my parents than for me. But it was a good thing, but it just opened up a lot of doors for me because like even this scholarship opportunity, these professors, we were in contact because I was valedictorian and we were trying to see and navigate how I can join academia, so that we don't lose, the title and, whatever it comes with. So a lot of doors in my life have been opened because of that title. So it remains a highlight. I still quote it even if it's 7 years ago.
Yeah, it was a big thing. Yeah. For many pharmacists, radiopharmacy is still a mystery. What exactly is radiopharmacy?
So radiopharmacy is a pharmacy specialization where you get to deal with radioactive drugs. Okay. And radioactive drugs are different from other drugs in that, number one, they're radioactive, of course. Yeah. So it's unlikely that you'll find them stored in a shelf somewhere because they'll be emitting radiation. Yeah. And the second characteristic is that they expire very fast. So they are accompanied by two things that make them expire very fast. The first one is something called half-life. Okay. And from definition in pharm school is the time it takes to reduce the quantity by half. Yeah. So if I make 200 now, the radioactivity will be, depending on the half-life of the molecule, let's say like fluorine-18, the one that you make, if the half-life is 2 hours, in 2 hours I'll only have half of that. In the same volume, in another 2 hours I'll only have half of that. So the potency does not remain constant compared to your normal drugs. And also the moment the drug is ready, it also expires extremely fast. Yeah. So that therefore means that they have to be made near where they are used. Okay. So you cannot buy them and store them for years. The expiry is 10 hours, so we make them the day the patient is coming, whether it's for diagnosis or for treatment.
Yes. What role do radiopharmacists play in patient care?
When we make the drug, there's no, so we usually say there's no nuclear medicine without a radiopharmacist. Okay. Because there's no nuclear medicine practice, whether for diagnosis or for therapy, that can ever occur if you don't have radiopharmaceuticals. And radiopharmaceuticals are our clinical expertise. That's what we make on a daily basis. But also when we talk about therapy, using radioactive material, we now participate in the clinical care of the patient, the same way clinical pharmacists will participate in the routine care of the patient. Yes, but mainly, especially for countries and labs that don't have therapy, we will mainly be in the lab. But the moment now you bring the therapy conversation, you will find us now involved in the clinical one.
Oh, nice,
Yeah.
nice. How developed is radiopharmacy in Kenya currently? You're the first radiopharmacist, the first female radiopharmacist in
Yes,
Kenya. Yeah,
yes.
how is it developed right now?
Um, Faster than I would have anticipated. So when I went to study, by the way, I was studying probably to leave the country also because there was no, apart from Aga Khan, there was really nowhere I could work. But now, fast forward and looking back, you will find that now we have more than 7 sites that are having nuclear medicine services, and 4 of those sites have radiopharmacy services. So that means the demand even currently is more than the supply in terms of the expertise. So Kenya we still have a long way to go, of course, but we are probably in the category of Egypt, South Africa, in terms of development. We're only 5 years old. They are more than 50 years old in the practice of radiopharmacy and nuclear medicine. But the country has advanced to the level that now we are placed at par with them. Yeah.
That's good.
Yes.
What opportunities exist for pharmacists who want to venture into this field?
A lot. So nuclear medicine as a career in general, from radiopharmacist to the nuclear medicine physician to the technologist, with the skills are rare globally. So even for Kenyans, some have trained and they're not working in the country, they have left for other countries.
Okay.
But if you were to look at the Kenyan context, you would find yourself mainly in a hospital setup because of the characteristics that I've given for the radiopharmaceutical, that you not mainly find them in a pharmaceutical company.
Okay.
But also we have companies coming up that are doing centralized radiopharmacy services where you make the drug and then send to the various hospitals, distribute to the various hospitals, but per day. So you distribute the batches on a daily basis. So your opportunities will mainly be in the pharmacy, in the hospital setup, where we have the manufacturing or compounding lab, depending on the scope, or in a company that does centralized radiopharmacy services. But also there are opportunities now that, of course, are going to come up soon in terms of regulation for radioactive drugs because it's still a new concept for everyone. So there'll be regulation. Of course, there's research, there's teaching, I teach. Opportunities exist beyond your normal conventional pharmacy practice, what you're used to as a pharmacist.
Okay.
Yeah.
I attended one of the webinars where you're speaking and you talked about regulatory affairs in the field of radiopharmacy. Did you talk about that?
So, regulation for radiopharmaceuticals is different from your normal drugs because radiopharmaceuticals will be regulated by 2 bodies. So you'll have the Pharmacy and Poisons Board because they are drugs, and then you'll have the Kenya Nuclear Regulatory Authorities because they are radioactive.
Yeah.
And that's where now we need to harmonize and see who carries the upper hand. We have a license from PPB, but I don't have KNRA. Can I go ahead? Or vice versa.
Yeah.
So we still don't have an expert in the country, but we do have people at PPB who have been regulating us and who are doing an extremely good job at it.
Yeah.
But I believe, in my opinion, it's a specialized area that requires more pharmacists to venture into it. Even if it's regulatory affairs, radiopharmacy. It's somewhere where we need harmonization, because also another challenge that we are finding ourselves in is something called overregulation. And when you overregulate a field that cannot operate to the levels of universal biodeal etc., you end up limiting the access for the drugs because many people will be scared to venture into it. But also you must strike a balance between the regulation and patient safety. That's why I'm saying there's still a lot to do. We're also still planning as we go.
As you go.
Yeah.
When people think about radio, they think danger.
I know, yes.
Yeah, what are some of the myths and misconceptions in the field?
The biggest myth is that it's very dangerous. I'm not going to say that nuclear is not dangerous. Nuclear is dangerous, but nuclear has peaceful and non-peaceful uses, and medicine is one of the peaceful uses of nuclear material. So we are able to use the nuclear material to diagnose and treat diseases, and particularly if we're talking about cancer, and you will see the response with treatment. It's amazing. So that it's dangerous. When we talk about nuclear medicine, I don't think it's dangerous. A lot of people have come to me and asked about what about your own reproductive health as a woman, and even there's a pharmacist who called me the other day and told me the father is refusing to go for this specialization. But a lot of measures have been put in place to ensure that you really never have to worry unless you want to harm yourself, in which case there's nothing we can do. If you wanted to harm yourself, you can harm yourself in many ways, including using nuclear material. But the way the work is designed, the engineering is designed, sometimes you are as safe as being here. Like, there's absolutely no exposure. There are some components, especially when dealing with therapy and quality control, where we do get some level of exposure, but we do not get even to the levels that are established for you as a member of the public. So in my opinion, but mainly because I am trained, so I have the knowledge, it is not dangerous. It's fine. We have colleagues and trainers who have been doing this for 60, 50 years, 40 years, and they're fine. So, but the more you do it and the more you are trained about it, the less you fear it. But before you're trained, you see, of course, there'll be all these misconceptions about it. Yeah.
What does a day in the life of a radiopharmacist look like?
Tough.
What time do you work?
Yeah, so depending on where you're working, if I use KU Referral, Nairobi West, Aga Khan as examples, reporting time is from depending on where you are placed, it's from 4:30 a.m., 4 a.m. to, of course, you leave work early, but we work at night because we manufacture the drug when the patient is coming. So if the patient wants to scan the patient by 9 a.m., we have to start our work really early. So by Thursdays, we're usually very grumpy people because we're tired. If it's therapy, we can work normal hours and have the patient seen in the afternoon. But basically, our work means we have to come hours before the patient can come in. So it's usually night duty most of the time. Yeah.
And throughout the day,
you do many other things. You see, the specialty is rare. The specialty is needed in many other places. So you can be able to do a lot of things with your day because you're done with your work by 11, 12. So you have the rest of it.
okay.
Yeah.
What has been the most exciting or fulfilling moment in your career as a radiopharmacist?
I have two, I would say. The first one was being able to operationalize KUTRA, KHRH, and for it to be the first public facility to make this accessible to opinions. Because before KHRH, we had people going to India for these services or being managed without this modality, which means you are being either over or under managed when we talk about cancer patients. So being able to go get trained and come and pioneer KHRH as an institution was to me a very big highlight. And of course, being recognized as a top 40 under 40 because of that achievement was a very big deal for me. I used to see people being recognized at top 40 and 40, and I'm like, how? 40 people out of millions. And then one day you receive a call from Nation and they tell you you're going to be one of our top 40 under 40 this year. So it was a very big moment for me.
Yeah.
The other one was late last year where we were able to start cancer treatment using radioactive material also in public facilities and also, of course, across the country. So that also was a big highlight because especially for patients who had been told that there's nothing else we can do. Now we are giving them hope and giving them really good hope with less side effects.
Nice. You like using the term theranostics?
Yes, I do.
What is it?
Theranostics is seeing and treating. So it's the use of radioactive material to treat and diagnose. So what we do in theranostics is first we diagnose you and see exactly where the disease is. And because we're using radioactive material that have similar characteristics to what we're going to use to treat you, we are sure when we give you the therapy it's going to work. So you see, like the routine treatment, we just give you, we don't know whether your body will respond or not. So this is precision medicine because by the time we're giving you the drug, we are almost sure that it's going to work. And then even when we are treating you, because the material is radioactive and it's emitting radiation, we can image you and see where the drug has gone and whether it's working or it's not. So it's a life changer in cancer management.
Okay. How can someone become a radiopharmacist?
By wanting to become a radiopharmacist.
Where can they study? Is it offered in Kenya?
My advice would be first, first, of course, you must be a pharmacist first, and then finish internship. That's my advice. So be registered as a pharmacist first. So Kenya has no site that is accredited to train radiopharmacy yet. Because now we are there, we can train. It's only that now you have to go through the other major processes. But you can go. I trained in South Africa. A few of our colleagues trained in Europe. So you can go to South Africa, which to me is the most affordable, and also the only recognized one for English-speaking countries within our region, as far as I know. You can also go to US, UK, etc. But if the passion is to come and serve Kenyans, South Africa is where I would recommend. You will see everything, and also sometimes it's good to train in an African context. Because sometimes when you train in overdeveloped nations, you tend to have over expectations of what you should come and do for your country, and that becomes limiting because you are resource constrained. So train where the resources are minimal, like in your country, but also now because you have to keep learning. The field is very dynamic; it keeps growing. Now for the other few 1 month, 3 weeks courses, now you can go to the developed countries. That's what we have done, and also you're able to strike a balance between what is being done in really developed nations and what is being done in developed nations.
If pharmacy was a house with many rooms, what would make radiopharmacy interesting?
That's a hard question. That's a very hard question. It's for now, I would say mainly because it's different and the opportunities are limitless. So for a young radiopharmacist, if your goal is to make your ends meet and do it in a way that you feel your impact is being felt, it's purposeful. It's not routine. You will speak and a lot of pharmacists will not have an idea of what you're talking about. Then that's it. But it begins with a passion. You can't do radiopharmacy without having a passion for radiopharmacy. Yes.
That's the end of the conversation. It was nice having you.
Thank you very much. And I hope we can have a people to be able to join us and become radiopharmacists. But of course, my advice is normally go for what you're passionate about. If I didn't love radiopharmacy, you probably would not know my name. There are a lot of people who specialize in many other things, but you will never know who they are because they do not have a passion for whatever they do.
We know you because you have the passion.
Yes.
So thank you so much, Naksari. We hope to have you next time. Today it's raining.
It's okay.
Yeah.
Yeah. All right. Thank you, Doc, for having me.